Let's talk about gastric acid suppression or gastric acid suppressants. What are the indications for gastric acid suppressants? Well, one, GERD or gastroesophageal reflux disease. Second, erosive esophagitis and PUD or peptic ulcer disease, gastritis, Helicobacter pylori or H. pylori infection, and 5, prophylaxis. So what's prophylaxis? Again, prevention, right? So prophylaxis because of other drugs that can increase the acidity in the stomach, or as well as stress-related ulcers. So the first gastric acid suppressant drug that we're going to talk about is your H2 receptor blockers or H2 receptor antagonists. What is the mechanism of action of H2 receptor blockers? So one, it binds to H2 receptor and then it decreases the energy production for the proton pump, which then decreases the proton pump activity, right? And so it makes the parietal cells less responsive to histamine, and therefore the stimulation of ACH and gastrin also goes down and results in decreased acidity. So what are the therapeutic effects? As mentioned, decreased hydrochloric acid production, decrease in heartburn, or decrease in pain symptoms from the heartburn. Some precautions. We have to be very careful when giving it to patients with renal insufficiency and thrombocytopenia. Contraindications. The main contraindication is in the presence of any allergies to the medication. Side effects. Side effects include abdominal cramps, diarrhea, and lastly, thrombocytopenia, right? That's why we have to be cautious when giving it to those kind of patients because it can cause thrombocytopenia. And in addition, right, it can affect your kidneys as well. So it can increase your BUN and creatinine. Nursing actions. Definitely it's very important to assess for therapeutic and side effects as well as follow up the necessary labs when appropriate depending on what medications we are talking about. Now the drugs that you have to remember are famotidine and ranitidine.